You're listening to the Life with Old Dogs podcast, and I'm your host, Dawn Mimnaugh, primary caretaker of all of our wonderful senior German Shepherds right here at Woody's Place Senior German Shepherd Sanctuary. Hey there, and welcome back. I just have to say right off the bat here, I am sitting in my living room holding the microphone and I'm sitting here in the dark. Well, not completely in the dark. I have a flashlight, but we just had this wicked, crazy storm move through the lake region of the Poconos here where the sanctuary is located a couple of hours ago, and our power has been out. So I needed to record this podcast, so I moved my setup, and I'm sitting here in the living room in the dark, well, by flashlight, and I'm holding the microphone. So if the sound quality is a little off on this, I apologize because I'm not stationed at my normal setup where I record the podcast, but it's fun. It's, sitting here in the dark is fun. Hopefully the power will be back on soon. But anyway, okay. Here we go. We are still covering the 20 most common health issues in senior German Shepherds. And I think we're about a quarter of the way through. And let's see. This week's episode, we are going to be talking about cataracts in senior German. Now, I just want to make one thing clear here. I mean, there are other reasons that your older German Shepherd's eyes could look cloudy, aside from cataracts. For instance, we have little Miss Nona in our care, little Miss Nutty Nona. And she has cloudy eyes, but it's not cataracts. She has what's called nuclear sclerosis. Okay. And that also causes cloudiness, but it's a bluish discoloration. Unlike cataracts, which is white and opaque. So, yeah, when you look at Nona, the first thing I thought when I saw her was, oh my gosh, she has cataracts in her eyes, but it's not. It's definitely not white. It is blue. It does look blue. And nuclear sclerosis doesn't diminish her vision like it would if she had cataracts. I mean, your dog can go blind from cataracts, but Nona is not going to go blind from nuclear sclerosis. All right. So just want to clear that up. There is another condition that looks like cataracts, but it's not. And Nona has it, and it's called nuclear sclerosis. All right. So as I mentioned, your fur friend could go blind from cataracts. Which could cause other problems as well. I mean, if your dog's having trouble seeing, he could be bumping into things, which could lead to accidents or injuries, which, of course, we don't want to happen. But if he's having trouble seeing, he's definitely going to be bumping into things that he normally wouldn't be bumping into. So that's a concern, him losing his eyesight, him injuring himself because he's bumping into things or falling down or thinking he's, stepping off of or a step and here there's two more to go. These are all major concerns. Additionally, cataracts could be a sign of other health issues such as diabetes. All right. So bottom line is, if you see that your older German Shepherd's eyes are looking cloudy, don't ignore it. Take him to the veterinarian and have them investigate what is going on. Don't just assume, he's an old dog. That's why his eyes look like that, because, that's not the way to handle it. You definitely want to get it checked out. Okay, moving on. What causes cataracts in senior German shepherds? The number one reason that an older German shepherd will get cataracts is because he inherited it. Okay, other reasons an older German shepherd would get cataracts is due to an injury to the eye. And then also, it could be an underlying health issue. Again, as I mentioned, diabetes. And also, in addition to that, he could get cataracts for no apparent reason other than he's of advanced age. Now, just a little side note here. If you didn't adopt your German Shepherd and you got your German Shepherd from a breeder, or you're thinking about getting a German Shepherd from a breeder, there is this organization, and it's the OFA. Okay, the OFA, the Canine Health Information Center, and they were founded in 1966. And basically, the purpose of the OFA, Canine Animal Eye Registry, is to provide breeders with information regarding canine eye disease so that they may make an informed breeding decision in an effort to produce healthier dogs. Now, this certification is performed by board-certified veterinarian ophthalmologists who either certifies the dog or the dog fails and doesn't get certification because it carries specific genes, such as genes for inherited cataracts. And I'm not really sure if German Shepherd breeders, have this done or not. But if you're going to buy a German Shepherd puppy from a breeder, you might want to ask if they have that certification, or at least if they are aware of any cataracts in the bloodline, just to be in the know, and then you can make an informed decision. Types of cataracts. So there are 3 main types of cataracts in dogs, which include congenital cataracts, developmental cataracts, and senile cataracts. So congenital cataracts are present from birth. All right, that means the dog is born with it, but that doesn't necessarily mean that the cataracts was inherited. Developmental cataracts, that develops with time, and that type of cataract normally isn't inherited either. Senile cataracts, this develops in older dogs, and this is what older German Shepherds primarily suffer from. Now, senile cataracts are a congenital cataract. All right, moving on here. Signs and symptoms of cataracts in your senior German Shepherd. As I mentioned earlier, blurry or cloudy eyes that look white. Okay, your fur friend is bumping into things when he didn't typically bump into things before, but now he is. He's not really sure about his foot placement. His peripheral vision is off. You might move a chair and he doesn't see that the chair is there, and now he's walking into it. Your fur friend is also struggling to find his way to his food dish, his water bowl, toys, or even his bed. He's having trouble getting on or off his bed. He's unusually anxious and possibly even snappish. He can also become over clingy, like just wanting to be by your side all the time because he's not sure. And also he could be reluctant to get up and move around. He might feel like he's on his bed. He's safe. He knows he's safe, but now he's just not sure. of getting up off his bed because he can't really see, and that's making him uncomfortable. Treatment options for older German Shepherds with cataracts. So again, hopefully, if your dog's eyes are cloudy, hopefully you take him to his veterinarian and get it checked out. And at that point, your veterinarian will determine the best course of treatment for your older German Shepherd based on his age and other factors, such as his health. If you have a German Shepherd that's geriatric, let's say he's 12, 13 years old, you notice that his eyes are looking pretty cloudy, they're white or opaque, you're pretty sure it's cataracts, you take him to the vet to get him checked out, you decide to have some blood work done while you're there. You find out that his liver levels are up, maybe his kidneys, he's not concentrating as he used to be. And then, yes, he has cataracts. I'm not really too sure that your veterinarian is going to say, yes, we need to get him in here next week and remove these cataracts from his eyes. We need to put him under anesthesia and surgically remove these cataracts from his eyes, because that's a big to do. Any procedure like that is a big to do when you're putting your senior German Shepherd under anesthesia. That's really, you really need to make sure that he's healthy enough to go under anesthesia and be able to, to handle the surgery. So to me, if that was me and I had a Woody's Place dog and, he's 12, he's 13 years old and he's developed cataracts in his eyes, I don't really know if myself and my trusted veterinarian team would choose surgery for that dog, or if we would just keep him as comfortable as possible for as long as possible. If he was extremely healthy, everything looked great, blood work looked great, heart sounded good, seemed to have quality of life left, then maybe we would decide to have the cataract surgically removed, but I can't say we would for sure. Now, if we had a senior German Shepherd come in, he's 8 years old, he's vivacious, blood work looks great, heart sounds good, all that good stuff, and he has a cataract in his eye, yes, we would probably have surgery. We would probably elect to have surgery and remove the discolored lens material from the eye, because at 8 years old, they have a better chance of going on for several more years and still having quality of life, where if they're 12 and 13 and, maybe their blood work's not so great, or their heart's not sounding so strong, or they, have developed a heart murmur or whatever, I don't know. I don't know if we would put them through that at that point. So anyway, treatment options may include surgical removal of the discolored lens material, treating underlying health issues, again, if it's diabetes, getting that under control, potentially eye drops, and possible lens replacement, which, to me, that's just not happening. Again, unless, it's a younger senior German Shepherd and a very, very healthy senior German Shepherd. All right. Preventing cataracts. Is there really a way to prevent cataracts? Prevention is not always possible. For instance, if the cataracts are congenital, it's not preventable. But there are steps that you can take to reduce your senior German Shepherd's chance of getting cataracts otherwise. You can reduce eye exposure to sunlight and bright light. So we had Heidi years ago, and Heidi had one cataract in her eye. She was actually blind in that eye, and she was born with it. So, it's not like she was 12. Well, they said she was 12 when we got her, but she wasn't, because she lived for 5 years after that. So she was she was crazy. She had tons of energy, and I think that the people just lied to say, said she was 12 to get her into our care, because we take German Shepherds 8 years and older. But nonetheless, we had Heidi, and she was born with a cataract in her eye, and she was blind in her eye. So I didn't know, if she was going to develop another cataract in her other eye. And I actually purchased doggy goggles for her for when we were outside, and they were very, very chic. They were pink, and all the other doggies were super jealous, and Heidi just sported them like, she was on the runway, and she showed them off to her doggy friends. And like I said, they were all jealous, and they wanted goggles too. Just kidding. But yeah, Heidi hated them. But I did. I did. I would make her wear her doggy goggles the best we could. Now, if we were just running out to go to the bathroom, I didn't put them on her. But if we were out in the field for any length of time, then yeah, when it was a sunny day, which doesn't really happen too often here in the lake region of the Poconos, I would make her wear her doggy goggles. Because it does help. It does help. And, I felt that it was important for her. So if you suspect your senior German Shepherd has cataracts, yeah, cover up his eyes. Get him doggy goggles. I mean, you can even get them on Chewy.com. They're not hard to come by, but do make sure that they're 100% UV protection. Okay. And again, I'll put a link in the show notes. I know you can get them on Chewy.com. I think even for less than $20. Really, they're not that expensive. And some of them are pretty fun and stylish, and that's great too. But the bottom line is, you're really getting them to protect your dog's eyes from excessive sunlight and bright light. And the other thing that you should do and can do to prevent, it's not really preventing it, but keeping abreast on the subject is get regular eye exams for your senior German Shepherd. So, at least once a year, maybe twice a year as they age. When you go to the veterinarian with your senior German Shepherd for their wellness checkup, make sure that your veterinarian is doing a thorough eye exam on your older German Shepherd. And finally, once again, if there's any sort of underlying health issue like diabetes, get that under control. All right, so this wasn't a long one. I can honestly say, in terms of any senior German Shepherd residents that we've had here at Woody's Place over the last decade plus, I know for sure we had cataracts once. That was with Heidi. Can't really recall cataracts any other time. We have had nuclear sclerosis prior to Nona. But as far as cataracts, any cataract surgery, drops, anything like that, haven't really had it. Just I believe one time with Heidi. We have had another eye condition, which I don't think it's in the 20 most common health issues with senior German Shepherds, but I'm not sure. I'll have to check. Okay, I just checked, and it is in the 20 most common health issues. It's pannus. Pannus is another eye condition that we have had several times here with senior German Shepherds in our care. So I'm not really going to discuss that in this blog post, because we will have a whole other podcast and blog post about pannus. So anyway, all right, in closing, cataracts in your older German Shepherd are clouding of the eyes, okay? White opaque clouding of the eyes, which is common in older dogs. If your older German Shepherd is having trouble seeing or difficulty walking, take him to his veterinarian for an exam. And if she determines that he does have cataracts, remember that cataracts is not the end of the world, but it does need to be addressed, and a treatment plan does need to be put in place and implemented. Okay, with treatment, such as surgery, his eyesight can be restored. Maybe fully or maybe to a certain degree, but either way, that will certainly enhance his quality of life, right? If he gets his eyesight back. But that being said, if you find that your senior German Shepherd has cataracts and you take him to the vet, and again, he's not in the best of health and maybe not a candidate for surgery, you still can help him at home by making sure you're not moving any furniture around, by helping him getting to where he needs to go and making sure he's not falling and bumping his head or poking his eye on something. The best thing that we can do for our older German Shepherds who may not be a candidate for surgery is to keep him as comfortable for as long as possible. Okay, I've said this in other podcasts, and I'll probably say it in more podcasts in the future, but that is the philosophy that we use here at Woody's Place Senior German Shepherd Sanctuary. We do whatever we can for these senior German Shepherds in our care. But the reality is these are older German Shepherds, either senior or even geriatric, and sometimes they are simply not candidates for certain procedures, or maybe the procedure is just too expensive, and the end result may not be what we are really hoping for. So there's a lot of factors to work through. And again, sometimes it may come down to just keeping them as comfortable as possible for as long as possible. Now, cataracts it's not as life-threatening as a bloat. We covered that in one or two podcasts ago, or cancer. But it does still need to be addressed, and it is up to you and your trusted veterinarian to determine what is the best course of action for your senior German Shepherd should he develop cataracts. Okay, folks, that's it. That's all I have for this week. This is kind of a shorter podcast. I am still sitting here in the dark. The power still has not come back on. So I really hope to get up in the morning and hopefully the power will be on. But that's it. That's all I have for this week. Next week, we are going to be talking about degenerative myelopathy. All right, that's number 6 of the 20 most common health issues in senior German Shepherds. Again, remember, when we created this list of the 20 most common health issues, we didn't do we just did it alphabetically. That's it. So next week is degenerative myelopathy. We actually have a lot to say about that because we've had a lot of dogs with degenerative myelopathy here at Woody's Place. All right. So until then, hopefully the lights will come back on and hopefully you'll all be well. Take care.